So welcome everybody once again to the Watering Hole TIFA Research webinar titled COVID-19, Is Our Money Safe? We are so glad that you could be able to join us today, and we are really excited to take the time to share with you what we find to be a thought-challenging conversation of the times that we are experiencing today. And with me are panelists who are with us and will be joining us as we go along throughout this particular webinar. With me at this particular moment is Maggie Reri from TIFA Research. Maggie, wave. Also with us is Mr. Mohammed Hersi, who's a member of the National COVID-19 Emergency Response Fund. Karibu sana.
Thank you, Makazi.
And also we have with us Her Excellency Madam Majalam Lagui, who is the Deputy Governor of Taita Taveta County. Karibu sana, Your Excellency.
Thank you.
And also scheduled to join us are Dr. Maxwell Okoth. I think he's online, but he's having a problem getting in. And also Senator Ledama Olekina. So without further ado, I think we can begin the conversation, ladies and gentlemen. I think what we are intending to do here today is to have a quick discussion on the issue of funding, governance, and how we as a country respond to this COVID-19 pandemic. And key issue here is the question of the funds that have been made available both to government and the private sector towards combating this pandemic. I think most of you would be able to know now, and the country has been bringing a lot of issues with the fact that what has been given up until this moment is data, facts and figures, but allow me today to share some of that with you. That presently we're looking at 4 million cases of COVID worldwide, about 277,503 deaths, some recoveries, about 1.4 million recoveries. And in Kenya in particular, we've had 649 cases as of today, with sadly 30 deaths. And we feel for the families that have lost loved ones because of this particular pandemic. And we've had 207 recoveries that we've experienced. So when this pandemic hit, the Watering Hole, being a group, WhatsApp group that brings together different thought leaders from across the country to discuss issues that are pertinent to the country, we decided that we should take the time to have a discussion around the issue of governance, accountability, because there's a lot of money that's been put forward to try and deal with this pandemic. And we thank the efforts that have been done up to till this particular juncture by the government, by the private sector, by other individuals towards trying to do everything possible to alleviate the suffering of our people and also carry out interventions that will benefit our people. Now, I was hoping that we could be able to share with you all a couple of slides that would be able to show you more about the subject. But at this moment, I'd like to, again, introduce one of the panelists who has also just joined us, Dr. Maxwell Okoth. Karibu sana daktari. He's the founder of Ruai Family Hospital. Karibu. Good.
Asante sana.
Good. So quickly, without further ado, I'd like to just give another quick opener about the funds that when we talk about money, the funds, what kind of money are we talking about? And I'll quickly run through what we are here to discuss. As earlier this week, just this week on the 6th of May, the IMF announced that they're making available 73.9 billion Kenyan shillings to the Kenyan government towards the COVID pandemic. The World Bank on the 2nd of April also made an allocation of about 5 billion shillings towards the pandemic. As at the 30th of April, and I know Mohammed Hersi here will give us an update as to the funds that have been able to be raised by the fund that was created by His Excellency the President, there was 2.7 billion raised in that particular emergency response fund. Also, there has been a measure put up by the Council of Governors, who committed on the 15th of April 5 billion shillings towards combating this pandemic. The government of Kenya also, through the Ministry of Labour and Social Protection, has set aside 10 billion shillings towards helping the needy and vulnerable in our society. And so many other organizations have come forward to put across some money that will enable the country be able to combat this pandemic. And according to a website that we've had the chance to look at, the actionfortransparency.org, they're saying that the total amount of aid that's available for the country as of today is 180,807,972,350. That's a staggering amount. 180 billion that's available to the government of Kenya towards responding to this pandemic. So I'd like to ask the panelists that we have here today, and I think it's no better person can be able to open for us this webinar other than Mohammed Hersi, being that you sit in that particular high-level response fund that was created by the president on the 30th of March. Bwana Hersi, where are we? What have we been able to raise, and how is that money being catered to? What is it being spent on?
Okay, thank you, Raj, Mokesi, and fellow panelists, and good evening, all the guests out here this evening. Well, on a Saturday, on a normal days, we'll be doing something else, right? So today here we are, and I'm just breaking my fast, and good to be here. Now, very quickly, you've talked about 180 billion. That's a staggering amount, let me say. That's a lot of money. That's close to the budget that Kibaki took over when he came in 2002. That's huge. So today's discussion is up in the sense that we need to start discussing governance. On my part, I will be looking at the fund that was created, or rather the board that was created by His Excellency the President. Firstly, I'd like to thank His Excellency the President for appointing me, and also looking at tourism industry, because I represent the Kenya Tourism Federation, which brings in all the tourism players on board. When you look at the team that His Excellency appointed, is purely private sector. And our chair is the MD, CEO for East Africa Breweries, Jane Karuku. And then notable, people who are respected in the private sector, the CEO of Equity Bank, Dr. Mwangi. We have Jeremiah Wori, Barclays, Oshira Waruru, Citizen, Joshua Igara, KCB, and many others. And then on government side, we have His Honorable CS Matiangi. And then Council of Governors is also represented by their chair, that is Oparanya, who's the chair, His Excellency Oparanya, who's the chairman. So when you look at it, 80% is private sector, people who have got their own credentials, people who run successful businesses, and people who do things above board. So His Excellency was very right on the people that he appointed. Now the question is, and people keep asking me, hey, are you now in Nairobi? I want to say this, all our meetings are virtual meetings. This is the new norm now. So we've had close to 8 meetings now, and we've been very active, and we meet every Tuesday at 10 a.m., close to 1 hour, 2 hours at most. And then we've had two, 3 subcommittee meetings as well. So far, we've been able to raise close to 2.7 billion, which includes a few pledges as well. But some of the key donors have been Kenya, KCB have donated 150 million. But first, let me start with the government that gave us the seed capital of 150 million. But they are looking at giving us close to 10 billion eventually. But that's just the beginning. So we've started off so that we can continue collecting from others. Then we have NCBA as well, who have contributed, I think, 100 million. And then we have Barclays Bank and many others. So in total, we are looking at 2.7 billion. But the other thing is this, we are encouraging everyone. It doesn't matter how much you want to contribute. If you go through the website, which is already active and it's live, you'll realize that the people are contributing as low as 100 bob. Very much welcome. In our appreciation, which is being handled in terms of communication, by Washiro Rowan on behalf of the Media Council of Kenya, who have donated 150 million worth of advertisement space for us, both print, electronic, name it. We are thanking everybody. We are putting alongside anybody who has contributed 100 million, for instance, is next to somebody who has given 200 bob. So we are not selective and trying to appreciate people who are just being the big bucks. Of course, we appreciate them, yes, but we want also to show people that, look here, you've given us your 200 million, which is your 1,000 bob. That's your 200 million, when we appreciate it. So we are appealing to all Kenyans. That's why we say bega ko bega. And Kenyans are known, to come together when we need each other. But obviously, there is an air of suspicion as well. You're saying, wait a minute, this money we're giving you, how sure are we that you're going to utilize it the right way? Without getting too much into it, because this is the whole discussion, we are going to talk about it. Exactly. But I just want to answer the question you've given. Have you spent any money? I want to tell you, we've spent zero so far. We've not spent any money. We're just about to spend, I think, from next week, where we have identified what we want to do. And there are two main things. The first one is medical. And that's why we were created, to help the people in the front line to deal with this menace called coronavirus. And then number two, what is left is to start addressing the issue of humanitarian. I'll come to it later on. I think that's a good opener. Thank you.
Good. Thank you so much, Mohammed. That was a clear opener. Indeed, we've been able to understand what you've been able to. I think the only thing that you could probably provide for the audience here is the actual website which you referred to, that they can be able to have a look at should they be interested to know about it. Yeah.
Yes, I'll be more than happy. Please take this down. It's kenyacovidfund.co.ke. kenyacovidfund.co.ke. I also want to say this, Chair. There are many people who have come up with their own forums where they're raising. So there's everything that reads COVID this, COVID this, COVID that. I want to say we only have one Kenya COVID fund. The rest, it's okay. We have no quarrel with success. If they're able to raise funds and help people, we have no quarrel with that. But in our case, it's Kenya COVID Fund. We are available as well on Twitter. We are on Facebook, very active. Please follow us, and you'll be kept updated. Thank you.
Good. Thank you so much, Mohammed, for that. Also, I'd like to bring in the other panelist, Her Excellency, Madam Majalam Lagui. Like I mentioned earlier in my opener, the county governments have made every effort not to be left behind when it comes to addressing the COVID pandemic. And for this, we have seen them establish a county emergency fund, which there was an announcement that they will be putting up 5 billion shillings towards trying to carry out some response at county level. However, we've also noted that most counties have set up their own versions of what Mohammed Hersi has in terms of different counties have set up different funds. Kisumu did theirs on the April 9th, Laikipia, April 8th, and Taita Taveta, which you are leading, is on April 5th, you set up a response fund where you're receiving cash and donations in kind. My question to you is, how has been the response at that level? Have Kenyans been contributing to those calls for donations? And what have you, either as a county government of Taita Taveta or what you've witnessed from other counties, how has that been put to use? To what use has it been put? And is there any key learnings that you're experiencing at this particular time that will give confidence to Kenyans? We can't hear you.
The mic.
Can you hear me now?
Yes.
Great. Thank you very much, Mokesi, and thank you to all the panelists as well as everyone who's joined, the 53 attendees that I can see online. This is a very timely conversation because as Kenyans, we're all very concerned about the manner in which the funds, especially from our own pockets at a time such as this, are being spent. As you've put it, the county governments have all tried to figure out what is the best way of mobilizing resources that would be utilized at the county level, and then to see what can be mobilized and consolidated to then flow up to the national level. We have to admit that there's a challenge at the counties. When the first case was announced on the 12th of March, most of us were very concerned about our preparedness of it, mainly because of the limited resources that we're getting from the Exchequer, or the slow release in funds to the county governments. And this directly impacts our ability to be able to equip our hospitals with the necessary PPEs, with the necessary drugs for addressing COVID, with the necessary response measures for our teams who need to move around, especially when they're doing contact tracing. So as a county government, we've looked at the issue on two bases. The first is, what do we need to mobilize on an operational perspective? And this is where we're relying heavily on county government funds, together with what we'll be getting from MOH, Ministry of Health, and national government in general, to look at the PPEs, to look at the equipment that we require for our isolation and quarantine areas. And then we're also looking at the socio-economic impact that our citizens are going through. Taita Taveta is generally a poor county. Over 50% of our population is below the poverty line. So when we had to get to a point of certain measures of cessation of movement, of lockdown, it means that a lot of the income that our citizens are generating on a day-to-day basis, most of them casual laborers, most of them looking at vibaruas, it was a challenge. So the resource mobilization committee that we set up was specifically looking at how do we cushion our citizens, especially in terms of having food in their homes. How do we make sure that the person who was working in the hotels that are now all closed within our county have something that they can support their family with? And the people that we identified to be able to sit on the committee, similar to what has happened in the national committee, are business people, successful business people within our county, in addition to the county employees. And they form, county employees are probably about 4 of them out of the 32-member committee that we formed. And so far, they've mobilized quite well across within the county and friends of the county to getting foodstuff donations, getting cash in kind, although the majority of the donations has been foodstuffs, the maize, green gram, sorghum, and the rest. We're also now moving to a point of looking how we can mobilize for face masks for all of our citizens. It's not just about the foodstuffs. I'd have to say that it's still a bit of a challenge, because you find that most people who you want to reach out to mobilize for these funds or for the donations are not liquid. They're also dealing with their own challenges economically. They're also dealing, and this is people from Nairobi, people from Mombasa, people from United Kingdom, United States. Everyone is trying to see, how do I conserve whatever it is that I have for me and my family, as well as see how I can help out the rest. So it's unprecedented times where even charity in itself takes a different form than it did previously. However, we're optimistic that we are going to be able to continue with the mobilization efforts that have been happening so far. It's been a bit of a challenge over the past week or so. We've so far managed to reach more than 6,000 households out of the over 90,000 households within our county. It's still not enough. And depending on how long the impact of COVID has on our economy, we would need substantial assistance from both national government, development partners, and generally every good Samaritan that is in Kenya and without Kenya. From a perspective of governance, if I could conclude on the governance front, we're being very prudent in how we're managing our resources. We have formulated emergency fund regulations, a bill and regulations that are now at the county assembly. We've also formulated, or rather drafted, COVID-19 resource mobilization regulations according to the Public Finance Management Act, because we want this to be something that can be reported upon using the necessary frameworks that already exist, the public finance requirements, the quarterly reporting that county governments need to do, and making sure that the measures that would make the citizen comfortable about the prudent use and allocation of resources is actually happening within the county. And I'm sure most of the other county governments who have set up similar funds are doing the same.
Good.
Your mic.
You can hear me now? Yeah, it's quite interesting to learn that you have been able to come up with different mechanisms of trying to, one, determine who are the vulnerable within the society, and also the question of putting up a bill and a set of regulations to try and see how you manage the funds that you receive. But before I was hoping that we could have Dr. Max in, but I think he had left. So I'll quickly try and come back to I'll just quickly ask the two of you some of the questions that have been quickly raised here. Or am I seeing Dr. Max coming in? Okay, let me just quickly run to it. Mohammed, Mokhtar Ogle is asking a question. He's asking, are there targeted outcomes or expenditure programming that you have come up with that you can be able to say that from the point that you begin to spending the money, that you'll be able to track how those funds are utilized, they reach their beneficiaries, and also be able to be accountable? Because if I can remember correctly, the president in his speech, Labor Day speech, stated that at the end of this whole pandemic, all these funds will be audited. So what have you put in place as a board to be able to see to it that from the moment you begin spending, there will be clear accountability of the monies that you've given out?
Good. I've seen actually the comment, or rather the question from Mokhtar Ogle, and obviously issues to do with accountability is top on the agenda. And allow me to state the following. Number one, we have a couple of auditing firms that have come on board, and most of them are actually giving us their services pro bono. They're not charging. That's how committed Kenyan firms are. So the first one is Ernst Young, who are going to handle the program management in totality. And then we have Deloitte, who are doing the audit and assurance. So we are not dealing with only one firm. We have got several who have come on board to help us so that we are able to prove to Kenyans that every single cent that we receive, whether internally, externally, is actually accounted for. Then on governance, we have KPMG, who have come forward to handle specifically on matters governance. And then to wrap it all, for the at the end of it all, we have Ernst Young now, who will come in and give us the full management report. And this is now what His Excellency the President will be looking at to see whether everything was above board, and we played clean, and we delivered on our mandate. And I just hope that Mokhtar and everybody else who's listening to me, that is what we are doing. And we promise you that we follow to the letter and make sure that every single cent is accounted for. Just to give you an idea, today and tomorrow, we have the tender committee that's very busy, and the health committee. We're going through some of the first procurement that we want to do. And since it's medics that we are addressing, we want to protect them. And the procurement that we are doing, we have brought on board the Kenya Medical Practitioners, the professional body, Dr. Korir and all her team, who said, because we co-opted them into the health committee. And today, together with the chair of that particular committee, who is the CEO of Kenya Association of Manufacturers, who is part of our board, they've been very busy going through this, the people who have tendered and the samples, and to make sure that they actually fit. Firstly, the Kenya Bureau of Standards, then the health team, the doctors themselves, the users are able to look at it. We are not going to buy things, and dump at them and say, hey, this is what you're going to use. Because COVID is not any other, when you're buying the PPEs, for instance, this is not the usual procurement where entrepreneurs can come and mess up. You're talking of life and death here. You're talking of a professional who's putting his life on the line. And you can't allow anybody to come and short-circuit the system because they want to make something out of it. So that's totally out of question. I just want to confirm to you and reassure you that the doctors themselves are part of us, and they're going through everything to make sure that everything that we do is above board. And of course, all the auditing firms that I've listed, they will play their role as well. I just hope that gives you some confidence. And for those of you who are still worried whether to donate or not, please start writing your checks.
Good. I see Dr. Max. Thank you so much, Mohammed, for that. I think you've mentioned that you're integrally working with the practitioners, the doctors who are at the front line of addressing this particular pandemic. And with us, that's why we thought it wise to have within the panel Dr. Maxwell Koth, who is the founder of Ruai Family Hospital here in Nairobi. And before I ask you to contribute, Daktari, there's something that I thought I should be able to put to the audience here. The Senate, in its third progress report, the Senate Ad Hoc Committee on COVID-19, chaired by Senator Johnson Sakaja, they did a report, and as at the status, the numbers that we did have on that particular, at the time of writing of the report, that's the 18th of April, thereabout, and towards the end of that month, certain statistics came forward to the fore. The first is about testing, that the country has a testing capacity of 37,000 per day. But the total tests that we have carried out until today stands at 31,041 tests. So we're still quite low in that particular metric. And in that particular report, KEMRI made a request for additional funds of about 790 million to be able to meet the requirements that are required to carry out testing in the country. On the question of ICU beds, the report stated there are 518 beds available in the country. 94%, which is about 448 of those beds, are currently in use. Now, as a country, we've only set aside 37 of these ICU beds for use for COVID. And this is at a deficit of about 190 beds, because it's projected that it will be required the country will require about 227 ICU beds to be able to deal with this pandemic. Also, there's the question of ventilators. 297 are available in the country at the time the report was being written. I know there have been attempts at procuring additional ventilators, but at that particular time, only 90 were available in public facilities. And some were yet to be distributed to the various parts of the country. PPEs, the numbers at that time, and this is just mid of last month, only 3,682 pieces were distributed. So this is why I'm coming to you, Daktari. This pandemic is like no other, and there are demands, and it's a strain on the things that are required. Usually, it's not every day that people would require ICU beds and also ventilators. So what have you seen has been the response by government, by private sector, and where would you suggest, or where would you recommend that both government and the private sector, and even the fund that's being run by Mohammed Hersi, or the ones that are being run by the counties, where should they commit their money towards, so that we can be able to deal with this pandemic? I know the numbers are still low, but in your opinion, where should we be spending this money?
Thank you very much, Mokesi. Apologies for being on and off. I don't know whether it's my network, or when it rains in Kenya, everything seems to be in a mess. There are things that I'd like us to address first, and it's called housekeeping issues. When COVID came in, as a country, I thought we should have sat down as a nation and in bringing all stakeholders who are involved. You realize that 52% of the medical facilities in this country are private and faith-based. And it's usually private is about 37%, faith-based is about 11%. That brings almost a 50-50 representation between government and private. Unfortunately, I'd hate to say this, but it is what it is. I feel like the majority of the private hospitals have been left out in preparing for this pandemic in case it goes out of hand in the way it has gone in other countries. It is out there in the community. I think that's something that everyone knows right now. The first people who interact with these things are probably going to be private institutions that are built within the communities. How do they deal with it when they're not being brought on board to tackle this? We have concentrated so much on the public hospitals and forgotten that there's another half of the stakeholders that deal with almost half of the population. So we need to bring in private hospitals on board, number one, because we cannot bury our heads in the sand and say this is a public health issue and let's deal with the public health sector. That will be a lie in itself. As it is right now, what is on the ground, private health sector, private hospitals, and I'm not talking about the ones that the people in this panel know of, are scared of dealing with COVID patients or anybody who's suspected to be a COVID patient. Because first, if there's any contact with any COVID patient, COVID positive patient, we all know you're going on quarantine. Most of these people are dealing with a staff establishment that is not as huge as the government. And so what we have done in essence, we have neglected respiratory conditions. That is the second leading cause of death in this country at 13% after HIV, which is 14%. So in essence, in the next few months, you're going to see a lot of deaths, God forbid, which are going to be either neglected health respiratory issues, which would probably just be asthma, would probably just be basic pneumonia. And so that is going to be another issue that we're going to deal with and forget as we think about COVID. That said and done, if I was sitting in that place today, and this is what I would do as a medic, first we are under testing. And so that is not giving us a clear picture of who out there, because according to extrapolation, it looks like right now, if you're going to see with the test that we have, the test that we've done, we have 387 that it was, how many positive tests as at fifth total testers was about 22,000. Right now we're at about 31,000 tested. If you look at that, it looks like we have about 78,000 people out there who are positive. But how would you confirm that if we don't test them? So the first thing that the government should do is to invest in testing capacity. We have had a lot of challenges in testing people. Either the transport media is not there or the collection kits are not there. We've had complaints of patients in quarantine who are being delayed from being released in quarantine because tests have not been done. So the first huge investment, because it's the second month down the line, I will ask you a question. If today you had bed bugs in your house, are you going to go through a procurement process to buy the fumigation? It's a problem. You need to run as fast as possible. And such moments call for different ways to deal with these things. We cannot have a procurement process that takes about 3 months. The testing kits would have been the first thing that would have brought in plenty. And these shortages, and I know there's an issue about the global logistical issues and procurement, and every country is asking for these things. But the first priority needs to go to testing, because only when we test is when we'll know how many people do we need to take care of. Before that, we can have 1,000, 2,000 beds set aside for COVID patients, but we don't have them, or we don't know who has it and who doesn't have it. And then before we realize, we just have patients dying and dying and dying, and we do not manage it. So the first thing that I would ask is, can we prioritize testing before anything else? After we do testing, then now we said, I know there's a preparedness in terms of the beds we've set aside. Right now, people are talking big of putting ICU beds, but how many of these patients will need ICU beds? Because if you're going to control this thing, you need to minimize contact in the worst case scenario to about 70%. Right now, we don't know. People are walking left, right, and center. They could be positive. But what that means is we are not minimizing contact. We're actually spreading this thing further. And we might get ourselves in situations where some countries have ended up with. So first would be, let's deal with testing kits so that we are able to test as much as possible. Then from there, we are going to set aside how many hospital beds do we need for COVID patients? How many ICU beds do we need for COVID patients? While doing that, we do not forget that the other diseases have not taken a pause. And we also set aside, this is a COVID hospital, so that there are other hospitals that will set aside to deal with the common problems that we have always had. Because now everybody's thinking COVID. And my fear is we're actually losing more patients right now than we've ever lost before from normal illness that we would have actually managed because everybody is thinking COVID. If you have a fever right now in a hospital, even the thought process of making a diagnosis has been converted. Everybody thinks about COVID first. And what is the case fatality rate for COVID? It's not as much as possible. So there are other more serious illnesses that we should not divert our attention from. And so the priority would be first, let's deal with testing. Then after testing, of course, it comes with the PPE and the protective mechanism for us to do this testing. And then now we go to the hospital beds first with isolation, and then the ventilators will go. The problem with Kenya, we want to start thinking of the big things. Let's build a big hospital. Let's build a big tent that will cater for COVID patients. Let's buy ventilators, you know, but we have not done the primary thing. That is where I would probably put my money in.
Thank you so much, Daktari. That was a very interesting way of looking at things, that the priority for the country should be investing in testing kits and procuring towards testing. I would love to interrogate the panelists from their contributions as they've given, but this is the moment where I need to bring in the other host in this particular webinar, Maggie Ireri. She's from TIFA Research. And Maggie, we were conducting a survey prior to this particular webinar. And I'm sure this is what we are now ready to listen to, what that survey was all about and the results from that particular survey. Karibu.
Okay, I hope you can see the presentation on the screen. Yep.
Yes, we can.
Okay,
yes, we
thank
can.
you.
Yes, we can.
Okay, just confirming. Yes. So thank you very much, Mwakesi. Thank you very much, the other panelists. Very interesting conversations. So my role here today is to bring a different perspective to the conversation. And the perspective that I'm going to share is a perspective from the audience. So what happened is, before this webinar, we requested the participants to fill a survey, and that's what I'm going to be presenting. Very short questionnaire. And please note that they filled this questionnaire before they had your presentations. So don't imagine that they're reacting to what you said, but let's see what their thinking is. So if you look at the first slide, we were trying to profile the kind of people who are participating in this webinar. And the question we asked, looking at your employment status, what type of organization do you work for? And we can see a majority, 71% are from the private sector, 15% from the national government, and you can see the others. So we can then assume or even conclude that this particular webinar has attracted a lot of people from the private sector, especially when you're talking about money, our money. The other question we asked them was, generally speaking, how concerned are you about the management of funds to help Kenyans cope with the effects of COVID-19? And we can see a big percentage, 82% are saying very, very concerned. Only 3% are saying they're not concerned at all. So basically, this topic is interesting. Money is a key thing that is making people get concerned, and that's why they're participating in this webinar. So this question, we basically said a number of, okay, so sorry about that. So a number of institutions are currently managing funds for COVID-19 assistance. And we asked them, how safe do you think the funds are on a scale of 1 to 10, where 10 is completely safe and 1 is not safe at all? And bottom line, this is a perception. Regardless of the facts that have been out there, this is their perception. So the organization or the group that scores the highest is private individuals or private-led funds at 6 out of 10. Then you have the Ministry of Labor and Social Protection. I know they've been giving funds to a certain particular group, and they score 3.3%. Ministry of Health at the forefront, doing press briefings every day, communicating regularly what they're doing. They score a 3.2 out of 10. And this could be attributed to the kind of conversations we saw last week about the budget and how it has been spent. Members of Parliament, here we're asking about the CDF. We've seen a lot of members of Parliament going out to their communities, donating PPEs and helping them. They score only 3.1. The COVID-19 emergency fund, and here we are referring to the fund that Mohammed is talking about, the score is 3.1. And that's very interesting. When you talk about COVID-19 emergency fund, it's 3.1. But when you say the private sector led fund, it's 6 out of 10. And there lies some sort of contradiction. Perhaps the private sector has not communicated strongly that they're very actively involved in managing these funds. County governments, Majala, I'm not necessarily referring to Taita Taveta, and I'm just saying this is perception, it may not be reality. This is what people are thinking, 3 out of 10. So if this is a perception, and all the ones who are scoring below 10 begin to ask us for money, begin to say support us financially, if the rating is below 5, I doubt they will be giving you any money to support COVID-19. So I just want to put a caveat. This is not a national poll. It is not a representative poll. It is a poll based on the people who registered for this webinar. And basically, we need to be addressing some of the concerns that they have. Thank you very much. I'll hand over back to Mwakesi.
Thank you very much, Maggie, for that. And I think it's quite an interesting perspective that you've shared there. And also what the audience is expecting, the attendees are expecting out of this particular webinar. I think the question that I probably would want to bring back to Mohammed here, and I know it's been asked here, you've mentioned that you're putting together, you're working with the private sector, you're working with audit firms to be able to set up different committees that will ensure that the procurement is done in a manner that is transparent and you get value for money. There's a question I'm being asked here, and I need to ask you as a person who's a Kenyan, and also Majala, you being also another panelist here. The country has no Auditor General as at now. When shall we be able to adequately address the issue of audit of these funds, or should we wait until this pandemic comes to a close? That's when we start looking keenly at issues of audit. When I'm asking the question of timing, when do you feel, as people who are directly in the front line doing interventions, when do you feel is the best time to start looking at, are you losing money? Are you spending money in the right way? What mechanisms have you put in place to track that even before we get to the point of carrying out an audit?
Yeah.
Majala,
you.
So that was directed to me?
Both you, Hersi, and Majala.
So you're asking what mechanisms have we put in place to make sure that there's accountable?
Exactly, because we're getting questions that people are asking, that level of accountability, that now an audit, people expect it at the end of the exercise. This exercise is going on for the next, we don't know how many months. So what are the little mechanisms that are being put in to ensure that there's some form of accountability as you go along with the expenditures you're incurring?
So
okay, I think ladies first.
Thank you.
Go Majala, and then I'll be after you.
So from the county level, the County Resource Mobilization Committee is meant to be an independent appendage, if I can call it that, of the county government. And they have the terms of reference where they're meant to be having very stringent reporting guidelines for both the county government, the executive, and the assembly, as well as to the public. So far within Taita Taveta, we've been very transparent with what has been collected, what has been donated by the public, both from the funds as well as the food and non-food stuffs. And even as, I guess this is more of an informal mode of transparency, because sometimes we think transparency is all about reports. Every single time that there's any form of distribution happening across the county in all of our 20 wards, there has been documentation of how many people are receiving, how many households are receiving the goods, what has been distributed, and we're very clear on what is within the food packages. That becomes a form of information that the citizens can use as accountability, tracking what we're saying we've received versus what it is that is going out there. Now, in terms of, it doesn't necessarily mean that because we don't have an auditor general, we cannot audit our finances, we cannot track what has been spent so far. Every single county government has a financial planning department that is able to produce some of these reports on a quarterly basis. And the fact that we don't have the individual, the auditor general, doesn't remove the strength of the institution, if at all it exists. And I'd like to believe that it does exist. So from our point of view, we're looking at it that we will be providing quarterly reports. We do provide these quarterly reports because they're meant to be forwarded to certain arms of government, such as the county assembly, as well as the control of budget and the rest. If we're looking at the public finance management regulations, then this starts forming the entry points for transparency, for access to information that will then guide the citizen about what has been spent, what they need to be questioning, and keeping us in check for, if at all there's that requirement.
You raise a very interesting thing, and I remember, Mohammed, when you were making your presentation, you stated that the funds are to be spent for two different purposes. One was on the priority of the medical, and second was the question of humanitarian purposes. I want to ask this question because there's a lot of concern from people regarding the humanitarian component of it and how that money will be dispensed. The identification of who's vulnerable, who is in need of that humanitarian assistance, and tracking to make sure that that money reaches those particular people who need that kind of assistance. What are the modalities that you've put in place for that particular purpose, and especially identification of the vulnerable persons who are to be beneficiaries of this?
Okay, I think my mic.
Now it's actually off. Switch it on.
Now it's on now. Yes.
Yeah, now it's on.
Good. Firstly, let me touch on the issue of the Auditor General. I think wearing my hat of corporate governance trader, that position should not be vacant for too long. And I hope that is going to be sorted out and we have an Auditor General. But for me, an Auditor General will equate him to a traffic cop. Just because you don't see him on the road doesn't mean that you break the law. And just because we don't have one doesn't mean that we will not do things about it. And remember, even the other day when we met, we were clearly reminded that, look here, guys, you must get your documentation all in order so that 2-3 years down the line, we don't want anybody being dragged to a court of law because you misappropriated funds here or there. And trust you me, none of us in the Kenya COVID Fund would like to see that happen to us. There are three kinds of, what can I say, contribution that's coming to us. Number one is cash donations, which is made public, which is on our website and everywhere, from as low as 100 bob to 200 million, name it, and it's all being made very public. Then number two are the people who don't want to give cash, but they want to give in kind. For instance, recently, one of our own who is on our board gave 100 million worth of oxygen. That is Guru, the owner of Devkistels. Even the ones who are giving you cash, they also stipulate, they clearly tell you, look here, our money is going to be spent purely on protection of medics. And we want you to buy for them the N95 masks, the PPEs, specifically on the medics. Then number three are the independent people who are in many other places who are collecting funds also to help us to deal with this problem. That's why a notice was issued that everybody should register with us. Not because we want to bring in red tape, no. We just want to know where you're located and who you have helped, because so that we do not duplicate the people who have been assisted. And what we realize also is that the people who tend to be closer to good road network were getting the help. Take the example of slums. You take Kawangware, you take Madare, you take Kibera. People who are very close to what can be easily accessed are the guys who are getting help. Then the guys who are in the interior are actually forgotten. So and this is the time also we're using the Huduma number that we were all crying about sometimes back. It's coming in very handy to answer the second question that you asked me, in a short while. So the independent groups are telling us who they've been able to assess. And all that is being tallied so that if you give to Mohammed Hersi and his group, let's say somewhere in Tana River, you will be able to know where we took the funds that you gave us or the stuff that you gave us in kind. And all that is coming to the Kenya COVID Fund, because we want also to make sure that whoever is doing something somewhere in the name of COVID is also held to account. And I think that is a very fair of doing it. Now, coming to the cash aspect, number one, as I said earlier, our top priority is how to protect our medics. And Dr. has mentioned here that we're also facing a lot of challenges. And I agree with him 100% when it comes to testing. That's the first place. Test, 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 test. If you don't test, you're basically shooting in the dark and you really don't know what you're looking at. Now, a little bit probably to help Daktari is that we also have the Kenya Private Sector Alliance, where entire board also sits on that team. We have private sector. The chair of the health sector is none other than Dr. Amit Thaka, who chairs the health committee at KEPSA Forum. And I just want to tell you that the Kenya private health institutions are also very well represented, because you clearly said it, it's 50-50. Government cannot say that, look here, we can do all these things alone. Through KEPSA, we've been able to achieve a lot by working with government to make sure that whatever that has been planned is actually implemented. And that's the reason why all the board members of this COVID fund are private sector players. So to fast track you on the issue of procurement, for instance, we've brought on board doctors. We've co-opted many other people who are not necessarily on the board per se, but they have come in so that they can help us to point us in the right direction. And first things first, we're giving first priority also to Kenyan farms. Suddenly, our EPZ, remember our EPZ actually produced fabrics and products for the European and the US market, where the needs, or rather the standards, are also very high. They are now able, 2-3 of them have already been identified, were able to supply PPE kits. And today, the health committee, which is made up good number by doctors themselves, they've been going through them. And we will be sharing with the public on our website to tell you how much we've paid for a theater mask, how much you've been able to pay for an N95 mask. We are not going to let you wait for an Auditor General's report 2 years down the line. That's going to be history. So we want to be it's real time, so that you start getting the confidence. Because remember, if you're not transparent, if you're not telling people what exactly you're doing, the scores are going to be 3. In fact, with my sister Majala here, we are the ones who've scored 3 and 3.1. We want to be at 7.5, 8.5, 9 if possible. Only then will people come out to contribute, if they know that their money is going to be spent the right way. So I just want to assure you, we're not going to wait for Auditor General's report. And that is why we've decided to take 4 different audit firms to come and audit us and sit with us throughout the process. And I've seen here when I go through the charts, and I do understand the suspicion by Kenyans. They're saying, hey, you don't trust these people. They're going to be graced. They're going to be compromised. I think, you know what, my prayer, Chair Mwakesi, is have faith specifically to the Kenya COVID Fund. I want to assure you, the ladies and gentlemen on that fund, we will make sure any amount that you've given us, we are going to account for it up to the last single cent. And I just want to say this, we are not drawing any allowances, let alone tea worth for $1 million. We are on virtual meetings, so you cannot even share tea, let's put it that way. So I just want to assure Kenyans, and I know there's a lot of suspicion how your money is going to be spent. I just want to confirm to you that every single cent is going to be accounted for. Thank you very much.
Thank you so much, Hersi. Daktari, I want to come back to you. At the start of this pandemic, and you can be able to tell us more about the pricing, because you run a hospital and you've pretty much been aware about the cost, what it takes to procure personal protection equipment, the gloves, the face masks, and things like that. What was the prices then, and what are the prices now? And my question, and the reason why I'm asking you this is as a country, you've mentioned statistics that respiratory illnesses have always been seen as having a high probability of leading to a cause of death, right? At about 13% from your last discussion. So why didn't we see this coming, and why didn't we stockpile enough to be able to face such a pandemic? And what do you think we should do going forward? Because we're raising money, we're raising tons of money. We have 2.6 billion being held by Mr. Hersey alone. There's a lot more coming in. What should we be able to do going forward to ensure that we are never caught this flat-footed again? Because we're lucky the numbers are not that high, but what can we be able to do in terms of strengthening our accountability mechanisms in terms of procurement from a public and private perspective, so that we do not get caught flat-footed as we have in this particular time?
Okay, thank you very much, Mokesi. I'll start by the tail end of your question. We were caught flat-footed. I don't think that is anything to blame anyone. This thing has happened across the world and nobody saw it coming. When they were saying there's COVID-19 in Hunan, there's nobody ever thought it would get to Africa, not even the States, not even Italy. And so nobody ever saw it as something that would hit us. We thought it was a Chinese problem. And it came. I remember we used to buy face masks at 220 shillings, a box of 50. That gives you about 4 shillings per mask. It reached a point it was 7,800 for a box of 50. So the capitalists took advantage of this situation, and they still are taking advantage of the situation. And this is where we need the government to come in and help us. There needs to be a regulation and restriction, and even if need be a price control. I know the prices went high across the world, but they didn't go to those extents we saw in this country. The other day, Carrefour bought masks at 650. Right now they're out of stock. Where have they gone to? Somebody has bought them to wipe them off so that they can hike the price. Are we running a country that has morals? This thing affects everyone. If you go and hoard these things in your house and you get this COVID-19, where are you going to take these masks to? So you can see how much the cost of running healthcare facilities have gone up. One thing, we are an industry that we cannot afford to lay off staff at this point, because those are our soldiers and we need them in the battlefield. A PPE coverall has moved from about 500 shillings to now it's 10,000 shillings, 7,800 if you get a deal. So basically, to dress a staff top bottom in a PPE, you need 10,000 shillings. Those are the figures we are looking at. These are things which ideally would have been about 1,500 in a normal setup. We are looking at price increment of about, is it 1,000 or 1,000,000%? I mean, it's ridiculous. So I think, and I remember when this came up, we wrote a letter as Kenya. There's a Kenya Association of Private Hospitals. Unfortunately, we are not represented. As Mohammed has said, we are not represented in that board. I know there's Kenya Health Federation, but most hospital owners are members of Kenya Association of Private Hospital, CAF, and Rural Private Hospitals Association. And so there's a public outcry, and we wrote a letter to the ministry that why don't you regulate prices? But if you cannot regulate prices because we are in a liberal market, open KEMSA so that we can buy these things from KEMSA, because we are still treating the same public that the government is trying to treat. So if you sort the public sector and buy PPEs for the public sector and private sector is still exposed, it means 50% of your population is still exposed. So the cost of running facilities has been insane right now. It's crazy. It's ridiculous. Of course, you're putting your staff exposed, and so sometimes even to assure them to be at work is also another discussion you have to put. This is a time that the government should have called upon all the private insurances to fast-track payment of hospital claims to hospital owners, both public and private. This is a time the government would have called NHIF to work on an overdrive of even 110% to ensure that backlog of pending bills are paid to facilities to enable them run smoothly so that we can be able to be prepared. But as it is right now, in my own honest opinion, I don't think we are ready for this thing if it is going to hit us the way it has hit other countries. We are only lucky that the cases are not as bad as they are other places. But in the event, because it's in the community and seeing the numbers the way they are going, in the event it goes to that direction, then I'm a worried person wherever I sit. I don't know if I've answered all questions. If there's anything I've forgotten,
so is there anything that you would recommend that, because I know there's still lots of money coming in, what would you envision to be a way of us preventing being caught in such a position going forward? Should we then focus more, because you know what is really killing Kenyans every year, and what are the strategic
Yes.
things that we need to set aside? What are the strategic things that we need to set aside in terms of how we spend that money?
First things first, I think we need to have a mapping of each and every county, set up county hospitals that are going to deal with COVID, and how to buffer them even post-COVID for them to survive. Because today you choose a hospital and say these are COVID hospital. Post-COVID, if at all we'll ever have such a thing, people are going to shy away from this hospital. How do you make them operate even beyond that? And then set hospitals to continue with the normal healthcare system as usual. Non-communicable diseases, infectious diseases, cancer, and all these people. Because right now with this lockdown, you can imagine whoever had a parent who comes for radiotherapy, because you know we have, I think, 2-3 radiotherapy centers in this country. That person cannot leave wherever they are to this place until they get 1,000,001 documents for them to be able to come to Nairobi. These are the vulnerable population that, again, you need to safeguard from being exposed to COVID, because these are the people who, ideally, in the statistics around the world, they're the ones who succumb to COVID. So how are we going to protect these people so that the normal healthcare system continues as usual and COVID is also taken care of as usual? That's number one. Number two, how are we going to control prices for essential things we need to be able to protect ourselves against COVID? If Carrefour can bring masks at 650 shillings, then it means the government can be able to bring the cost of masks back to where it was at 220 shillings. Because he's the regulator of everything, and he can be able to manage these things. So how can we be able, just cause a market disruption, whoever is holding these things wherever they are will eventually release them in the market. At that point, when they realize there's nowhere they're going to take them. From masks to coveralls to gloves. You know, a box of gloves used to go for 450, 350 wholesale. Right now, you're finding a box of glove going for 1,000 shillings. You get me? By their places, if you go to salons, they're fully dressed top to bottom. But if you go to hospitals, we are struggling to get these commodities. So you see where the diversion has gone to. The public is fighting to get N95 masks, which ideally you don't need in the public when you're walking around, while hospitals don't have N95 masks. These are issues to do with regulation.
Yeah.
And so we need to bring a sense of discipline and order in the public system so that they know what belongs to the public, what belongs to the healthcare system. So once you sort out where do people go for what, and who takes care of what, then take care of now the cost of taking care of service. And cost of healthcare service in this country has been a discussion for very many years. And this is the time we need to sort it out. I'll tell you, when we were buying ventilators, one machine would go for 1.25 million. Landed cost, taxes paid from China to here, or from Spain to here, depending on which model you take. Right now, a ventilator is going for 4.5 million. Even getting it is hard because you call the producer, they tell you we are still producing for Italy. After that, you're producing for Spain. The next time you're going to get your consignment is October next year. Has he helped you? He hasn't helped you. So in terms of healthcare preparedness, and this thing has taught the nation, as much as you'd want to invest in the military, healthcare is another war front that can hit us very hard. And I think the entire world has learned this. So at any point, we need to be prepared as a nation to take care of any healthcare calamity or pandemic that might come our way. And if we are able to do this, then I don't think there's anything. It's a wrong time to start discussing how many ICU beds do we need. The next question you need to ask, out of these 518 ICU beds, how many are in public and how many are in private? I would bet you 70% are in private.
Yes.
That's a very bad case scenario, you know. So it's time that we sit back as a nation and say, how are we going to manage the healthcare system? Bring all stakeholders on board and bring a way that even standardization of care in terms of quality, cost, and everything, so that people start competing on quality. Then everything else will fall in place. Thank you very much. I think I should have answered everything else, unless there's any question.
No, thank you. Thank you so much for that. I was expecting, in fact, you've gone above and beyond, and which is very helpful to us. I wanted to ask Majala one question, but I see that she has left for now. So, Maggie, I know you had intended to carry out a poll during this webinar, so please take it away as we wait for Majala and hopefully Senator Ledama Olekina, who is joining us shortly on the webinar.
Okay, thank you. So what essentially I'll be doing, I'll post a poll on the screen, and I'd like to request the panelists to participate. No, not the panelists, the attendees to participate. The panelists cannot participate. You can only see the reaction. So when the question is published, you need to participate, and then we'll discuss the results. I have two questions, but let me share with you the first one. Okay, so I'm clicking on the first one. Can you see the question on the screen? The question essentially reads, no, the panelists cannot see. If you had COVID-19 symptoms today, if you thought you had, would you go to a health center for voluntary testing? This is aligning to what Max is saying, and the answers are coming in. The panelists look very, very curious. I can see Max smiling. I'm going to read out the results, and then we can have a discussion around that. I can see they're still coming in. This feels like it's the IBC kind of process. I can see the results coming in slowly by slowly.
You can.
Okay, so let me end the poll. Oh, now somebody has just voted before. Let me write it down. Oh my God, they're changing. I think guys are participating as we go along. So I was about to, there was a point where the yes and no were almost at par. Now they're changing, okay. I think we close it. I'm closing it in 3 minutes. Actually 3 seconds. 1, 2, 3, and I'm closing it. So from what I can see here, if the people who are in this webinar, if they had COVID-19 symptoms, only 56% would go for voluntary testing and 43% would not. 56 say yes, 43% say no. So I think at that point I will pause it, and Wakesi, give me another 5 minutes. After 5 minutes, I can do the second poll. Maybe we can discuss those results now.
Yes. So thank you very much for that. So this is a very interesting issue, that if you had COVID-19 symptoms, 56% say they would not be able to go to, they would go for testing, voluntary testing. But is this the situation on the ground? Majala, what are you experiencing in terms of the numbers that you're receiving within your hospitals? I know there has been raised in the news media that the number of cases, the number of people who've been going to our hospitals has greatly reduced, because people are fearing to be found to have COVID or to be quarantined for the sake of it. What have you done to encourage people to go into to the local hospitals and also, wherever possible, carry out voluntary testing? Microphone.
So I'd like to be slightly controversially honest about this. County governments, especially ones that are not city governments, don't necessarily have the capacity to test as frequently as, for example, Mombasa, Kilifi, Kisumu, Nairobi are able to. And there has been challenges with some of the transportation media that would enable us to transport the testing kits, or rather the samples, from the county to the testing areas. Now, what we've done is we have really done a very good job of sensitizing our public about what to look out for. What are the symptoms that you're meant to be looking out for? What should you be concerned about? How do you ensure that you've not come into contact with someone who has traveled from a COVID hotspot that could then potentially mean that you've been exposed? To be perfectly honest, no Kenyan at the moment is going to be very comfortable with voluntary testing, especially when they're not clear on the capacity to either self-quarantine or afford the charges that were previously being levied for quarantine purposes. So from the county level, we haven't necessarily noted that there's been an increase of people saying that they want to be tested. What has happened is whenever there's a case of someone, a truck driver has been presumed to have come in from a certain hotspot area, or someone has traveled from one of the hotspot areas, people will want to be tested. That we've seen as a the uptake, if I can call it that, is something that people are volunteering for. What we haven't necessarily seen is people coming in not necessarily having had any kind of contact with any COVID patient, voluntarily coming in to say they want to be tested. And that to some extent has been a blessing to us because of the challenges of the sample mediums and the transportation of the test, and not necessarily having a testing lab within the county.
So have the numbers of people coming into the hospitals increased, or are they still the same? Just whether there was COVID or not, like looking at the numbers, have you had an increase, decline, or just stable numbers?
They've dropped slightly, and this has meant that we have had to encourage on local media and as part of our sensitization efforts to make sure that people are not missing out some of their regular clinics, that they're not missing, that pregnant mothers are still coming in to get checked up, that children are still adhering to their immunization schedules, for example. So there was some fear initially of coming into hospitals because they weren't sure how they would be received at the hospitals and what kind of service that they would get. But we've been very consistent with the messaging that, yes, we are preparing for COVID, but this does not disrupt the normal services in the health centers, in the dispensaries, as well as at our referral hospitals.
Good. I think you appreciate for that. Maggie, or do you want to say something, Max?
Sorry, Mokesi.
Yes.
I think the fear of going to the numbers that have gone down in hospitals ideally is not because people are afraid of being tested. The initial fear was because people thought when you go to hospital, that's where you are more exposed. And that's why I was saying that we need to have a separation, that different counties and the city, we need to map out and say, whatever we suspect or we think has COVID, then we will go to this. And then the other facilities go on as usual. Today, if you sit here as a parent and you have a child who's meant to go for antenatal clinic, and then of course parents will be very protective of their children, and then you think when you go to the hospital, because of the interactions the staff have with the various patients, they are more exposed, and so that is making people be afraid to go to hospitals because they think they will contract COVID in that place. And so to mitigate this, we would be able to separate, or even in the same hospital have a COVID wing. And I know it has a bit of stigmatization, but initially as we move forward, we'd be able to iron out some of these issues.
Okay, Maggie, do you have another question, or do we throw in another?
Maybe you'll allow me to comment on that as well.
Yes, please go ahead.
Yeah, on hospitals and visiting hospitals, Dr. you may correct me if I'm wrong, but the fact that serious campaign was put in place, simply washing hands, our hygiene levels have really gone up.
True.
Normally the month of March, April, and now we are getting into May, is normally the flu season. And you realize people sneezing, coughing left, right, center. At the moment, everybody is trying very hard not to sneeze, not to cough, and to make sure they keep safe. And that's the reality. People are building on their vitamin C intake. So the fact that because how is flu virus, spread? It's through, contact, dirty hands. And let's face it, that's one of the ways. And you realize this is a cold season and flu is coming in. Now, the fact that flu and COVID are so close, you just want to avoid it totally. And then again, Daktari, we were also told, unless it's absolutely necessary, that you feel quite unwell, don't go to the hospital. And many of us are actually practicing that so that you leave the medics to attend to more serious cases and the ones who really must go to hospital. So Kenyans have also decided to avoid hospitals so that they can give medics, time, simply because the Secretary has said it, because we don't have two separate wings, the main hospital, and then there's a COVID wing. It's all together. And the fact, the moment you're told a COVID patient, here the cost was a particular hospital. At the moment it was in the press that there was a COVID patient, the next day there was nobody. Even the ones who are there want to be discharged. So that is what Dr. has been alluding to. And yes, it is a challenge. And moving forward, that's going to be a huge challenge the day we get into post-COVID. Asante sana, Mwakesi.
Okay, so I'm going to do my last live poll. And the question that we want to ask is touching a lot on the topic. And also, if you look at the chat conversation, it looks like people have suggestions. And we just want to ask a simple question. And I remember initially there were conversations about the amount raised is about 2.7 billion. But in this particular question, I just want to pick 1 billion. So bear in mind, there's about 2.7 billion that has been collected, assumption. But I want to pick 1 billion. And in that 1 billion, we actually publish the question. And you can see it on your screen. And the question says, if you're the overall person responsible for the decision to allocate 1 billion to COVID-19, which one item, we are forcing you to pick only one, would you allocate it to? The first question, one of the options is equipping all hospitals, and I'm talking about private and public, purchasing PPEs for the general public, masks and sanitizers. The other one is improving quarantine facilities. Then the other one is on track and trace activities. And then the last one is supporting the vulnerable and the needy. So just waiting for the polls to run. And again, I say there's already 2.7 billion. We're only asking you to allocate 1 billion into one activity. One. Okay. Waiting. So I'm about to end the poll. Oh, Mohammed has left. Maybe the results are scary. I'm sure he'll come back.
No, I'm here.
Okay, so I'm closing the poll in 3, 2, 1. So you can see the results on your screen, and I'll read them. The highest, in terms of the highest allocation, is 38%, equipping all hospitals, private and public. Max, I think you'd be very happy to hear that, 38%. The second percentage is on track and trace activities. The people in this webinar want us to track and trace the people who have COVID so that we can contain the disease. Then the third percentage is supporting the vulnerable and the needy at 19%, and then 15% for the PPEs to the general public. So if I could conclude, the overall allocation would go to equipping hospitals, both public and private. So that ends our poll, and I want to thank all the participants for contributing to this poll.
Good. It's a very interesting perspective to find out that Kenyans are the people who are watching this particular webinar, and I think they should be representative, are more interested in having our hospitals equipped. And so then it becomes a very clear call for it means that the priority that Kenyans want to see their money spent on is equipping the hospitals and tracking and tracing and also supporting the needy. So what I want to ask, because we are really out of time, and since we called you as panelists here to get your perspective, I want to ask the question finally and hear from you. What will you personally do as a panelist in whatever sphere of influence you are in to ensure that our money is safe during this pandemic? What will you personally do to ensure that our money is safe? We can start with you, Mashala, or you can be last for the purposes of this. Can you hear me?
I can. You just said I can be last. So.
Oh, good. So then we can start with Daktari.
Do I have a role to ensure my money is safe? I think it's just public awareness to be able to hold whoever is accountable to be accountable. That's a much we can do. Other than that, I don't think we have much to do. I believe this is a parting shot, right?
Yes, you could
or
use
you'll
it
come
as
back.
a parting shot. You could use it as a parting shot.
Oh, you're coming back. If you're coming back, I would. My main concern is, as we discuss this, I don't know whether you'll have another discussion on the economic implications, but that's something we really need to think about. And where I sit, from where I sit, I think we are going about it the wrong way. We cannot buy foodstuff to the public. For me, that's treating a problem. And you are not treating the problem. You're just trying to, let's say you have a disease, you're only controlling the symptoms and not actually treating the disease. I think the government needs to come out and buffer the middle class. That's where the problem is right now. And people are not coming out to talk and say their problems because they are the so-called middle class. And that's where people are actually feeling the pinch more. If we protect this middle bracket, it naturally spirals down to the lower bracket. But if we buy food to the lower bracket and we have left these middle people exposed, then we are actually messing this country so badly that we are not going to get out of this, and it will take a very long time for us to get out of this. And so whoever has the ear to listen, whoever can make it reach the decision makers, I think there need to be concerted efforts and not public relation gimmicks to be able to protect the middle bracket of the economy so that we can be able to protect and cushion the entire economy. Because you can realize one single household that is a middle class takes care of 10 households in this country today. That is from the house help to the gardener, to the driver, to the car wash, to the barber shop. If you protect this person, you have actually fed 10 people. But you feed one person in the slums and you've left this person exposed, you've actually also starved that person in the village. And if you can be able to sort this, then we are able to take care of all these things. Why are Kenyans going back to the streets? They're going back to the streets because they need to eat. And so we're actually even exposing more contact to COVID-19. And in essence, anything we are going to do to be able to protect the spread of this thing is exercise in futility. We are not going to achieve that. So we need to protect and buffer these middle people. People will be comfortable, they'll stay at home, they'll be able to eat because it will spiral down to all these other people, and we are going to be able to achieve what we are going to be able to achieve. Thanks.
Mr. Halsey.
Oh, yes. Oh, it's me now. Good. I think let me pick up from where Terry left, the issue on taking care of the middle class, because more often than not, we look at the lower end. And that is, it could be a start, yes. But I think on the middle class, just to help answer that as well, Kenya Private Sector Alliance, we are now adopting also an approach that, hey, we need to start looking at how to reopen the economy. Because you cannot stay for too long in a locked economy. Because if you continue locking, then it means that the middle class is going to be affected big time. And one of the things that we are pushing for as Private Sector Alliance is to lobby and push government to pay the pending bills. Just to give you an example, the aviation and airline industry, over 450 million is owed by government of Kenya. That's 500 million shillings. If that 500 million shillings is paid, it means that you're able to pay your workers. Your worker will be able to pay people they've employed at home. They're able to send money to the, to the village and to help all the people that actually has just mentioned. So giving people, someone a fish is totally different from teaching them how to fish. Kenyans don't want handouts. People want to be given the avenue to help themselves. And I think that's very, very crucial. Now, on my part, you said, what do I need to tell Kenyans? This is my message. The message is very clear that where I sit with the team at the Kenya COVID Fund, we want to assure you that we will account for every single cent. Someone asked and said, hey, why are you just insisting on the website? That go to the website and get the information. We will share this with the media. Media Council is well represented, and they'll be able to broadcast everything that we do on virtually every week. So rest assured, anything that we buy, and actually now that we've met virtually, I'll take your contacts. And anything that we do, we'll compare notes with you. As much as you're not part of Kenya Hospital Federation, wherever the other association is, we'll make sure that you're an expert in your own area and you've got your own expertise. You should be able to help us and guide us in the right direction. Because one thing, Mokesi, I want also to say is that the funds that are collected are controlled by us as a board. It's not the government. So we are going to award tenders. We are going to sign those checks. We are going to release those funds. And at the end of the day, we're also accountable. It's very hard for us to be accountable if we were going to collect the funds and give it to somebody else. And that's not the scenario. So rest assured, ladies and gentlemen, fellow Kenyans, that we mean well and we will act well and make sure that everything we do is above board. And when it comes to a specific fund, we'll make sure that we are accountable to you. And we want to make this fund as one of the funds that have been, what can I say, managed properly, that even when Auditor General shows up, there's virtually nothing negative to report. And they'll say, well, everything was done above board and they can account for every single cent. Meanwhile, stay safe wherever you are, and let's work together.
Good. Madam Majala, Your Excellency, please.
So I want to respond to what Daktari has said, or rather request that this becomes a follow-on agenda for another conversation. It's very important for us to start discussing the economic impact and how we're actually addressing all levels of society from cushioning them from these impacts. I feel that if we say that we're looking at just cushioning the middle class, then we forget about some of the populations that exist in the rural areas that don't necessarily have that middle class that we're speaking about. So whatever interventions that we're talking about need to look at both the bottom and the middle class. I don't dispute that they need to be supported. It could be argued right now that even if you support the middle class, they're not employing their driver. The driver has been sent home. They're utilizing fewer house managers or house help because of the cessation of movement, as well as just generally trying to make sure that there's limited exposure. So those 10 households that we're talking about may have reduced from what they would normally were before during the normal times. But that said, I think it's something that I would be very interested to explore as a conversation, because I don't think any of us have the immediate and right answers for how we address this across the Kenyan economy. For your question about what will I do as an individual to help protect our funds, I think my response to that is clearly that we need to keep politics out of all of these management of funds, out of the governance structures. We need to come together more than ever, thinking through how we can leverage on our individual strengths as the various arms of government, whether it is the members of the National Assembly, both Senate and the Parliament, whether it is the national government supporting the county governments, within the appointed positions that we have through elections. It's very easy to want to introduce, I'm doing this for my constituents, I'm doing this because I have a greater say with my electorate. And right now, I think more than ever, we need to put aside the party politics. We need to put aside, I am better than you as a politician than not. This is about how do we think through this, the response that we need to have for our various contexts together as one community. And I've been articulating it in our various platforms at a county level. And I think that's something that I will continue to do, in addition to ensuring that whatever it is that we need to be doing as a county government, both executive and assembly, in providing those accountability measures for these funds are put in place as required. And I think a lot of this requires ongoing conversations. The more we have open and transparent conversations about the issues, the more trust and faith that we gain from the public. So far, a lot of the conversations on the chat has been, but we know this is going to be stolen, but we know this. And half of it is because, one, some people don't understand what needs to be addressed by who's responsible for what. And two, we've not necessarily communicated and informed the public about what needs to be happening and what is happening on a regular and consistent basis. So it's very important for us to have those conversations with the public, not being afraid to say the truth as it is. It's not business as usual anymore. There's no point in pulling the wool over people's eyes, thinking that this will give us more time to address the situation. I think on such a crisis, we need to work together, both public and private, to be able to address these issues.
Thank you so much, ladies and gentlemen, for this particular, your contributions. And I think it was very interesting to hear from you and your perspectives on how we should go about managing these funds, what priorities we should put, and the mechanisms that we should bolster to make sure that the monies are safe and that they're used for the benefit of our people. I think I will put up that particular slide for the benefit of everyone. And I mentioned these figures earlier. It's a staggering amount of money that's available for the government and for the country. And we would love, and the Kenyans are really yearning, that for once in our country, those monies will be put to good use and that this response will be to the benefit of the people. And so I'll call upon all of us as Kenyans that we might be able to hold our leaders to account and the leaders to do everything possible to safeguard our monies. Thank you for that commitment, Bwana Hersi and Madam Majala, and also Daktari for saying that you will take it upon yourself to follow through and even work with Mr. Hersi here to ensure that that money is kept safe. I'm sorry for not having Senator Ledama Olekina here. He sits as the chair of the Public Investments Committee. He would have given us insights from a Senate perspective of how they were going to manage the funds that we are looking at here. But beyond all that, I want to say thank you for everyone who's been able to attend. This is a webinar that was organized by the Watering Hole WhatsApp group together with TIFA Research, and we thank all the participants who have been able to join us. Behind the scenes, there was Wakili Juliet Nyangai, Liz Gitari, Mr. Jerry Kwea, and Kelvin Masika. Thank you so much for the work you've done behind the scenes. And as we are calling this particular webinar to a close, I would want to just ask if any of the panelists has one burning issue that they would like to mention. So, Daktari, did you finish what you thought was very important that you needed us to know?
Oh, thank you very much. I think it's been a very productive webinar. A lot of insights, I think I've learned. It's good to know that we have Kenyans of goodwill. I think, Hersi, I've been following you on social media. Very, very good insights, very objective. I think that's the direction we need to take as a country. I still believe all is not lost. There are Kenyans of goodwill out there who want the best for this nation. And with such people on such positions, there's hope. I want to tell everyone who attended this that let's not be pessimistic. Let's give them a chance. And I believe there are people who have reputations to keep. If there's anything a man needs to safeguard, is their reputation. And for that, I still have confidence that we're going to get the best out of them. I don't know about the other funds, because I think their percentage is very small out of all these figures that you are putting on the screen. But let's hope that even the other 73, 5, 5, 10, and the rest which are not valued would go into the right places. Thank you very much. And as we say, keep safe, social distance, wash your hands, do not touch your face. Yes, and we keep God and Allah above everything else. Good evening.
I think, Chair, you'll allow me to make a comment.
Please do.
In today's Standard, I read a piece that was it was a sad read, because we're talking about accommodation for medics, and the story is that the people actually were supposed to be accommodated so that they don't go back to their families, and to spare them, exposing them to the danger. Accommodation has been taken, but it's been taken by people who are not doctors or who are not nurses, the frontliners. And to me, that was very disappointing. And I think what I would like to say is this. It's been reported in the press, which is not Gata Press, Standard newspaper is main media. I would urge Kenyans to continue putting pressure on public offices, including our own fund. Ask us all the tough questions. And it is said normally, when you say the truth, you don't have to remember anything. So when I read that people have been accommodated and the real medics, people in the front line, did not even take that accommodation, that should concern everybody. And my question is this: can't we do something without, in Swahili we say, bila dosari. Everything we touch, has something. It's a bit tiring, because we're actually tired and fed up as Kenyans that anything and everything that we do, there is something somewhere in the background that eventually comes up. And for heaven's sake, let's not play around with the little funds that is supposed to go to the medics. If that accommodation is supposed to go to a nurse, it's supposed to go to a doctor, and you're not a doctor, you're not a nurse, you're not in the front line, you have no business taking that accommodation. And if you're watching me today and wherever you are, or you're a friend of that person, please tell them they should be very ashamed of themselves. But we need to step up. And Daktari, as much as you may not be involved directly, you guys need to speak up directly now and speak up very strongly about these things. Because our only line of defense are the medics. If we don't protect the few medics, we are done. The last thing we should be doing is stealing away from the medics. And I would like to specifically thank one person in this country, Dr. Mwangi at Equity Bank, who is also a board member. He contributed personal, contribution of 300 million shillings on his family. And he specifically said, I don't want my money to go to anything else. I want it to go to equip the medics in the front line. And I want the right price for everything that you're going to purchase. So, Daktari, have faith that we have a few Kenyans who will step out and stand up with the right people.
Thank you so much, Mohammed. I appreciate that. And I hope you will have a holy month of Ramadan. I know you're right in the middle of it, yeah?
Yes, thank you.
Yeah, good. And Your Excellency, any final thoughts before we call this to a close?
I just want to thank the panelists for a very insightful conversation. It has raised some particular points that, sometimes you forget about in the midst of rushing to be able to address all of the issues that we're dealing with. So I want to really thank Daktari, Chairman, yourself, Chairman of the COVID Fund and Chairman of TWH, for this particular conversation that we've had, and as well the panelists, or rather the participants, for the questions that they've been asking. I think next time let's try and see whether we can make it a bit interactive. But my final point is to thank the frontline workers. I don't think we could be where we are today without the response teams that are constantly going out in the middle of the night doing the contact tracing, all the way to the doctors who are waiting for the patients at the hospitals as well, the ones for the counties such as ours that doesn't have any case, and for the ones that are actually in the thick of things, in the various counties that actually have recorded cases and are treating some of our patients. I think we can only thank God that the variant that we have, I'm not a doctor, but the variant that we have has been of the mild to moderate strain, and not necessarily the intensity that has been seen in other countries. So my heartfelt thanks to all of the frontline workers. And I think as a country, this has given us a lot of time to reset, and we should take advantage of it and not be like the usual goldfish we are as Kenyans in, dealing with a crisis and then suddenly forgetting that we were actually getting onto a path of progression. I look forward to the next conversation. Thank you very much.
Thank you so much, everyone. I appreciate you coming in, and I thank you for taking the time. We've taken some time out of your weekend, but we appreciate that you had the time to do this. We will be hosting another webinar, and we hope that everyone who's been listening in, you can be able to join us on our next webinar. I also left out one other person, Violet Wanaina, who is a member of TWH, who also did a very good job in trying to put this together. So thank you again, Violet, for that. And everyone else, na shukuru sana, muwe na usiku njema. Stay safe, stay home, and let's observe all the guidelines that we've been given by the government. Thank you.
And thanks to you.
Thank you too.
Yes.
I appreciate it. Thank you very much. Good evening, ladies and gentlemen. Asanteni.